I just want to say thank you all for coming, taking out time of your day to come and listen to our speech. We are representing Mississippi University for Women's Bachelor's Program. My name is Kiera Evans, RN. I'm a nurse here at Methodist Shermantown Hospital on 3 East Observation Unit, and this is
Lakeisha Mays. I'm also a nurse here at University at Methodist Shermantown, and I also attend Mississippi University for Women.
My name is Jamar Reed. I am an ICU nurse in Oxford, Mississippi. I also attend the University of Mississippi for Women.
We have one other partner, Kayla Holcomb, that's also in our group, but she will be presenting at a separate time, but she's presenting also today at 2 o'clock, so she's our other team member. She originally is doing the first portion of our presentation, but because she's not here, we will briefly go over her slides as well. So we will begin, and our presentation is on insulin-dependent diabetes.
so here we go.
Good afternoon. How you doing there? Thank you for coming. Kiera, Kayla, Lakeisha, and Jamar will be presenting this presentation on insulin diabetes. Objectives we'll be discussing. At this conclusion of this PowerPoint, participants should be able to construct a disease management strategy for patients with type 1 or type 2 diabetes to reduce hospitalization. At the conclusion of this course, the participant should be able to perform how to check blood sugar correctly and administer insulin to control blood sugars. Upon completion of this learning PowerPoint, participant will learn how various nutrition and food affect blood glucose and learning to read food labels, estimate proportion size, and use healthful meal preparation techniques to control blood sugar. As a result of this PowerPoint, participant will learn that regular exercise and physical activity can also help blood glucose, blood pressure, and blood cholesterol levels. Type 1 diabetes. A chronic condition where the pancreas produces little or no insulin. Insulin is a hormone needed to allow glucose to enter the cell to produce energy. History of diabetes, 1910. English physiologist and Sir Albert Schweitzer studied the pancreas led him to discover a substance that would normally be produced in a non-diabetic insulin. The name comes from Latin word insula, meaning island. Reference to insulin-producing isolates of Langerhans and the pancreas. History continued in 1949. Rachel Levy, MD, discovered that insulin works like a key transporting glucose into the cell. Beacon Dickinson and the company begins production of the standardized insulin syringe designed and provided by the American Diabetes Association. How common is diabetes? Approximately 1.25 million American children and adults have type 1 diabetes. New cases, 1.4 million Americans are diagnosed every year.
Incidence of diabetes. With diabetes, there are deaths. Diabetes remains the 7th leading cause of death in the United States in 2010. Diabetes is not something you can catch like a viral cold. This is an approximate definition of diabetes. Diabetes is defined as an autoimmune disease where the immune system attacks the insulin-producing beta cells in the pancreas and destroys them. Who does diabetes affect? This disease shows no partiality to gender or ethnicity. Diabetes can affect anyone. It is usually diagnosed in childhood or early adulthood. Diabetes affects all ethnicities. Approximately 7.6% of non-Hispanic whites are affected by diabetes, as well as 9% of Asian Americans, 12.8% of Hispanics, 13.2% of non-Hispanic blacks, and 15.9% of American Indians and Alaskan Natives. And as you can see from our bar graph, it shows the ratio of the ethnicities affected by diabetes as an overall whole. Pathophysiology. Diabetes mellitus type 1 is the result of the immune system attacking the insulin-producing beta cells of the pancreas. Now, a lack of insulin results in a lack of glucose in the cells, leaving the body at a totally low amount of energy to fulfill cellular functions. What are the symptoms of diabetes? So, as we are, most of us are nurses in here, we all know that most of our patients come into the hospital and they have these most common symptoms of diabetes, which is frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision or blurry vision during driving or at night, tingling or numbness in hands or feet, better known as neuropathy, feeling very tired much of the time, very dry skin, sores that are slow to heal, which we all know diabetes has a slow healing process, more infections than usual, and they also sometimes can experience nausea, vomiting, or stomach pains, much of which that can be accompanied by the abrupt onset of insulin diabetes, now called type 1 diabetes. Diagnosis and prognosis. So you ask, how is diabetes diagnosed? Blood tests are used to diagnose diabetes and pre-diabetes because early in the disease, type 2 diabetes may not have any symptoms at all. All diabetes blood tests involve drawing blood at a healthcare provider's office or commercial facility and sending the sample to a lab for analysis. Lab analysis of blood is needed to ensure test results are accurate. These are some of the most common tests that are used to diagnose diabetes. An A1C, also called a hemoglobin A1C, or the glycohemoglobin test. You have your fasting plasma glucose test and an oral glucose tolerance test. Blood test levels. So basically this diagram just shows that your A1C in a diabetic is classified as a diabetic if their A1C is 6.5% or above. They're classified as a pre-diabetic if they're 5.7 to 6.4% is shown in the A1C, and a normal A1C is usually around 5. With a fasting plasma glucose, you usually see in a diabetic 126 or above. In pre-diabetics, you'll see 100 to 125, and a normal diabetic will usually be between 99 or below. With the oral glucose tolerance test, your levels for a diabetic are usually 200 or above. Your pre-diabetics are between the range of 140 to 199, and your normal diabetic oral glucose test will be between 139 or below.
Proper technique to check a blood glucose. This is a glucometer, and normally this is the one we use at a hospital, but the ones they use at home are usually smaller than this. And the proper technique is you're going to make sure that you always wash your hands and your hands are completely clean and dry before starting because you have residue left on your hands before. You're going to wipe with an alcohol swab. You're going to wipe until it's clean and make sure that it dries so there's no alcohol. Alcohol can affect the changes of your glucose. Then you're going to wipe it with a dry cloth. These are lancets, and you're going to prick your finger. And once you prick the finger, you're going to wipe the first amount of blood off because that blood normally contains a lot of plasma and it can change your glucose reading. Then you're going to kind of milk it until you get a blood. And you're going to put on a test strip, and then within seconds you'll have a reading. These normally work really fast. They're old. They're not like the older ones. They give you a reading within the first 5 seconds. And that reading is normally quite accurate, okay?
So, how exactly is diabetes managed? Diabetes, of course, requires continuous managed care, and in this managed care falls meal planning, physical activity, and if needed, sometimes medications. A diabetic that lives a healthy lifestyle lengthens their life expectancy at least 8 to 10 years. Let's talk about lifestyle changes. as a diabetic, we know that one of the most important things that are involved in lifestyle changes is the way you eat or the diet plan that you follow. So here are some of the most common foods that fall underneath the diabetic regimen for dieting. You have your beans, and that's your kidney beans, black beans. Your dark leafy greens, that's involving your broccoli, your spinach, any dark leafy greens. Citrus, sweet potatoes, berries, which is also an antioxidant for the body. Tomatoes, your omega-3 rich fish, that's your salmon, your trout, your mackerel, and that's pretty much the most important ones. Your whole grains, in which I brought granola as a representative symbol for that. This is a type of whole grain that's really good for you, as well as the apples that can fall in the fruit category. Your nuts, your fat-free milk, not skim milk, fat-free milk, and yogurt. Your lean protein, which is also, this represents protein as well. Asparagus, which falls in the dark leaf green vegetables, as well as broccoli. Carrots, flaxseed, apples, and we brought apples to show today. This is a great part of the great diabetic dieting regimen that you can follow. Your melons, your red onions, your soy, and also tea. Those are some of the most common foods that is good for diabetics to eat. The second most important thing that you can remember as being a diabetic that you need to always follow is exercise. Now, with any type of disease, we all know that exercise, you should at least exercise 3 to 4 times a week, at least 30 minutes a day. Diabetics that exercise are more likely to carry out normal ADLs. When I say normal ADLs, that's basically meaning that they don't have any difficulties while getting out of the bed, walking throughout the day. They are more likely to carry out the normal portion of their activities of daily living. The third option that usually falls within diabetic lifestyle changes is, of course, medication management. This doesn't always apply to all diabetics, just some people need an extra boost as far as if they cannot manage their diabetes with eating right and with exercise, they have to add medication. So, diabetic medications are not always a long-term effect of diabetes. A lifestyle change sometimes depletes the need for medication involvement. Or for those patients that do need medications, here are some of the most common diabetic medications that include but not limited to insulin, which is what we put most of our patients on here in the hospital, usually on a sliding scale. Januvia, metformin is another pretty common diabetic medication that you'll see a lot of patients on. And Vocana is a newer one that recently came out in the last 3 to 4 years. And your glycoside is another common diabetic medication prescribed to diabetics.
So you asked with diabetics, some of everything comes with ethical issues, and there are ethical issues that come with diabetes. Sometimes the most common are doctor-patient honesty, and it's really kind of dependent on the risks and benefits that come along with procedures. Some doctors are more honest than others and don't feel as if patients will comply if they are totally aware. And placebos. Placebos are kind of in the air. Some doctors feel they're good to use and some doctors feel they're not a benefit at all, but it's really mainly a mind thing. Another reason is what course to take for best treatment. Depending on the patient and the situation that they have going on, you have to weigh your options and depend on what's best for the patient, and sometimes that comes with a lot of ethical issues. When to end life-sustaining treatment is a very common ethical problem. When there aren't family members involved or they aren't as available, doctors have to decide on when it's time to make choices for a patient. Presenting or withholding information from the patient or their family, direct scarce resources to younger versus older people. Some doctors and some people come with ethical things depending on the age of the patient. Some people don't feel like they would do as much if patients are a little bit older versus a younger patient. Whether to dismiss a non-compliant or overuser of resources. A lot of doctors sometimes feel as if they want to release a patient because they do not want to comply with what's being told to them or follow the complete instructions. And free medications or samples given